Patrick.
Hello, how can I help?
Do you think quality improvement is for everyone?
Why do you ask?
Because for some time now, I've been thinking about getting into QI, but I'm not sure I'm up for it.
Well, I think the question should be, are you ready to make a change? Because quality improvement is all about change. But something you will need to have before getting into it is the will to work with your team, people with lived experiences, and others to make a change.
How do you mean?
Okay, look over there and I'll explain. So, a couple of years back, my team and I embarked on a QI project.
What was your project about?
We aimed to reduce the prescription of risperidone by 5% in care home residents with dementia under the Dementia Crisis Support Team in Basildon, Brentwood and Thurrock by the 1st of October 2017.
Why would you want to do that?
Because in a report commissioned by the government in 2009 titled Time for Action, Bernergy concluded that antipsychotic use was too high in patients with dementia in care homes and that the risks outweighed the benefit. It recommended an exploration of other possible causes of these changes in behavior and the use of non-pharmacological intervention for the management of these challenges.
I see. So how did you guys achieve your aim?
Well, before I tell you that, allow me to introduce you to the stakeholders. So the stakeholders are all the people who could affect our project, and very importantly, the people who would be affected by it. So for this project, that list ranged from my own team members to care home managers, senior carers, a pharmacist, a member of the Thurrock Clinical Commissioning Group, but most importantly, a patient with dementia and their loved one. In this stakeholder engagement meeting, we wanted to map the current journey of the person with dementia from the point of coming into the service and their journey through to the end point of discharge on how we prescribed risperidone. We did this using a tool called a process map. All of this is what co-production in QI is really all about. Working together with patients and stakeholders in equal partnership to produce SMART goals that will bring about change. But what's especially important is listening to the views of the patients, because they are the recipients of our improvement work.
Well, talking about SMART goals, how would you guys have known when the goal was met?
For that, we set up measures. So first off, we used the results of a clinical audit to get the baseline data of 21 patients on risperidone. And here we found some astronomical data. Then we used 3 key measures to track the progress of our improvement work. So we had a process measure, an outcome measure, and a balance measure. For our process measure, we went on to measure the percentage of a number of patients given risperidone every day over time. When we interpolated this data with the baseline, we got the end of our improvement work. And yes, we actually did it. There was a reduction in the percentage use of risperidone in care home over 6 months.
So I'm guessing the balance measure was...
Yeah, we used the balance measure to find out how our QI work affected other areas of service and the patient's care.
Patrick, this all sounds great. First, I understand what you were trying to accomplish through this project from your aim, and I can see that your change led to an improvement from how you collected the data and measured your progress. But like you said, QI is all about change. So tell me more about this change that you made that resulted in an improvement.
I'd love to, but this brings us to the change idea. We use the behavior chart to assess our patients. We call it ABC. That's antecedent, behavior, and consequence. But unlike other behavior charts, this one did not only track changes in behavior of our patients, but it also sought for possible factors outside of dementia that could lead to these changes in behavior. And then he looked into how the situation was resolved after the incidents. But that's not all. We also used the Pdsa Cycle to test our change. Pdsa stands for Plan, Do, Study and Act. At the planning phase, we drew up the behavior chart to be used by both the dementia crisis and care home staff. What we did at our doing phase was to train staff on how to use this chart. We then received feedback from staff concerning the usability of the chart, so we needed to study this in the study phase. Finally, as a result of the feedbacks, we knew we had to act on this by modifying the chart to make it more efficient and easier to use. And really, that's how we brought about change. At the end of the day, we achieved our main goal. We indeed reduced the percentage use of risperidone. In the future, my team and I plan to develop a training package for certain care homes around the area. We also plan to submit our findings to journals and in conferences so they get a wider reach.
Wow, Patrick, I now understand what you meant when you said quality improvement is all about change. But I see that this is no ordinary change. It's one that everyone is involved in, whether stakeholder or patient.
Exactly, my friend. So what was that your question again? Do I think
Quality improvement is for everyone?
Of course it is. QI is for everyone who is ready and willing to work with others to bring about change and measurable improvement. Now I have a question for you. Do you think you're ready for quality improvement now?
You bet I am.
That's great. As for me, I keep searching for avenues to develop myself in quality improvement, one of which was becoming a QI mentor. Now I look for opportunities to teach more people about QI and clinical audit methodologies and its benefits irrespective of their status, their banding, or their background.
Just like you've taught me, yeah?
Yeah.